In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover, and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow. Avoiding close contact with those who are unwell. The appropriate use of masks and personal protective equipment, especially in a healthcare setting. Washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
So we need to get the facts straight. How does this virus work? How does it transmit? Where does it want to go? And let's protect ourselves I'm Dr. Peter Lin. I'm a family physician in Toronto, Canada. The coronavirus is a family of viruses that can cause as mild things as just a common cold, all the way up to SARS or MERS. These are these bad pneumonias that we're talking about. And basically what these viruses are, they look like a tennis ball with all these spikes sticking out of it. And depending on the type of spike, it allows that virus to attach to certain places. So some viruses, they have the spike that attaches to your nose. So basically you just get a common cold. But the SARS virus and this new virus that we're talking about has the spike that allows it to attach to the cells in your lung. And when it attaches there, it puts in information to make photocopies of itself. So it uses our equipment to make more viruses.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Most of the coronaviruses live in animals. In this particular case, it was from Wuhan. There was a fish market where they were selling live animals. And the thought is that the virus was in a live animal, then it crossed into a human. But then what we found was that people were getting sick in terms of healthcare workers, in terms of family members that were looking after them, which now meant that the virus can pass from human to another human. Just like all viruses, it needs to reach a target, which is your lung. And it has to get there with your help. It has no feet and no wings. So therefore it needs us to move it there. So that's why we keep saying, don't hang around sneezy people because you're gonna breathe it in, and don't touch your face because that's how the virus is gonna get in. The masks are helpful, but they're not necessary because they're leaky. The ones that you and I buy basically have pockets here, so therefore the virus can get in. What the masks really do is they stop us from touching our face. If you're sick, we tend to mask you, so therefore you're not spewing out the viruses to other people sitting around you. The true people that have the real masks are the N95. Those are sealed. These are for the doctors that may be caring for the patients. So in the beginning, the coronavirus will cause kind of like flu-like symptoms or a cold. So people just get the stuffy nose, that kind of thing. But you'll understand that as soon as that virus starts manufacturing in your lung cells, they're producing all these copies of the virus, all of a sudden now you kill the lung cells. So now you can't exchange oxygen. And that's why one of the early symptoms is people get very short of breath and they tend to have a difficult time breathing, and that's why they end up in hospital. So currently, unfortunately, we don't have a direct treatment for the coronavirus. So we don't have a medication that can kill it off. And so it's really supportive. So in other words, the patient can't breathe, we give them oxygen, help them to breathe. They can't drink, so therefore we give them fluids to support them. Their kidneys begin to shut down, we help them with all those things. So it's a very supportive process. This is a new virus that we've never seen before. So our immune system, our army, are having a hard time figuring out what to do. So usually what we have to do is we make something called antibodies. So these are things that can grab onto the spikes that we see on the virus, and it'll get rid of the virus for you, and that will actually bring you back to good health. So therefore the elderly may have a worse outcome, and of course the young children. So the babies, their immune system is not so good either, so they may not make those antibodies as well. So just remember, your hands may be with virus. Virus cannot hurt you because it can't get through the skin, but the moment I do this, now I've brought the virus right to where it wants to go. So let's remember not to touch our hands to our face. So let's say you think that you might have been on a plane or you might have bumped into somebody that has it. What should you do? So the first thing is to contact a healthcare worker to tell them that potentially you have it. If you're feeling symptoms and you're going to go into a facility, call ahead. Okay, so whether you're calling the paramedics or whether you're calling the hospital or your doctor, just mention that you were on a flight. If you don't have any symptoms, then what we do is a little bit of a self-quarantine. In other words, we can just keep you away from other people, and so you don't go into parties, don't go with your friends, don't go into public transportation. So we can contain it very easily by making sure that you do a self-confinement, so to speak, for the, let's say, 7 to 14 days is the longest incubation time. So after that, if you're feeling well, then you don't have anything to worry about. So if we get the facts right, then we don't have to be overly worried, but we do the right things so that we don't get the virus ourselves and that we don't pass it on to others. And if we look after each other in this way, this virus will have nowhere to go. It needs us to move it, it needs us to make copies for it, and if we don't help it, then the virus will stop. So we have the power to do that right now.
Let me now share about what we know about this novel coronavirus. This virus comes from the family of coronavirus, which includes other viruses such as MERS and SARS, as well as the milder variants causing common cold. The medical consensus at this moment is that the novel coronavirus is more transmissible, but appears less deadly than SARS. Evidence suggests that the rate of human-to-human transmission of this virus appears to be higher than that of SARS. For now, the evidence also suggests that transmission is mostly via droplets. What this means is that the virus is carried within droplets emitted from an infected person over a short distance, such as when a person coughs or sneezes. If these droplets come into contact with the eyes, nose, or mouth of an individual, directly or indirectly through hands that have come into contact with these droplets, the individual may become infected. To clarify, there is no evidence currently to suggest that the virus is airborne. There are other viruses, such as the chickenpox, which can easily be transported via air currents, and do not require droplets to contact the eyes or nose. The novel coronavirus is not in this category of viruses. The novel coronavirus could also transmit through surface contact. Let me explain. When a person sneezes or coughs, the droplets fall onto the surfaces of tables and chairs, and the virus may remain alive for up to a few days. When someone else touches the surfaces of these tables and chairs, the virus can be transferred to his hands, and if he then rubs his eyes or nose without washing his hands, he may become infected. So we should wash our hands. This is also why we only quarantine the close contacts of confirmed cases. For more transient contacts, such as individuals that the confirmed cases may have walked past in malls or hotels, the risk of transmission is low. For coronavirus generally, the person is most infectious when he is displaying symptoms, or what you call symptomatic. And this is likely to be the case for the novel coronavirus as well. There is evidence of limited spread from a person without symptoms during the incubation period. However, this form of transmission may be uncommon and has so far involved isolated cases only. At this point, the evidence still points towards higher transmissibility when the person is displaying symptoms. As such, medical professionals, both overseas and in Singapore, have advised that the most effective way that we can protect ourselves is to practice good personal hygiene. We should regularly wash our hands with soap and water and avoid touching our face with our hands. These may sound simple, but actually they're very difficult to do because all of us touch our face all the time. Even at a meeting when we have on this ministry task force, while I was speaking, I was touching my face until Minister Lawrence Wong nudged me with his elbow and said, "Stop touching your face." So it is simple but extremely difficult, but are actually very effective in preventing all kinds of infection. Potential infection from asymptomatic persons, in fact, is less likely to be from coughing or sneezing directly because they don't have symptoms. They are not sneezing or coughing, but more likely by touching contaminated surfaces, for which masks offer no protection. Wearing a mask when we are well often gives us a false sense of security instead, and we are more likely to touch our faces when we constantly adjust our masks, which is one way the disease spreads. At the same time, we need to protect others, our loved ones, friends, colleagues, and fellow Singaporeans that we come into contact with. If we are sick, we should rest and recover at home as far as possible.
In the great outdoors, forever free. Sometimes you need